Good day everyone, my name is Grace Rimando from BSN 111 and today I'm going to perform my return demonstration in parenteral medicine. So, the first thing we need to do in this procedure is the preparation. So the first step in preparation is to check the doctor's order. So here is our doctor's order, so we're gonna check it. And after that, we're also gonna check for the MAR or the medical administration record. So here is our MAR, and we're gonna compare the MAR to the doctor's order. So everything looks accurate. And after that, we're gonna check for the label of the medication carefully against the MAR to ensure that the medications are correct. So, in checking the medication, we need to follow the 3 checks. So, the first one is to read the label when it is taken from the medication card. And the second one is to read the label before withdrawing the medication. And the third one is to read the label after withdrawing medication. So, after that, after we have checked the medication, the last thing we need to do is to organize the equipment. And after that, we're gonna prepare medications from vial. In preparing medications from vial, the first thing we need to do is to perform hand washing or hand hygiene. So we have already performed that one. The second thing we need to do is to prepare the medications for drug withdrawal. So to do that, I'm gonna mix the solution if necessary by rotating it between palm to palm. And I'm gonna remove the protective cap and clean rubber cap with wipes in a circular motion. After that, we're gonna move on to the withdrawing of the medication. So, I'm gonna open this one. I'm gonna attach the aspirating needle to draw up premixed liquid medications from multi-dose vial. We need to ensure that the needle is firmly attached to the syringe. So I'm gonna remove the cap of the needle, then draw up into syringe an amount of air equal to the volume of medication that we need to withdraw. So after that, I'm gonna inject the air into the vial. I'm gonna hold the vial down. I'm gonna move the needle tip to the fluid level. I'm gonna insert the vial and ensure that the needle tip is below the fluid level and withdraw the medication. So if there are any bubbles, we need to flick it. So that is all for the preparation of medications from the vial. And after that, we're gonna prepare medications from the ampule. So in preparing medication from the ampule, the first thing we need to do is to perform hand hygiene. And in preparing medication for drug withdrawal, what we have to do is to flick the upper stem of the ampule. So here is the ampule and we need to flick it several times. And place a sterile gauze or wipe between the thumb and the neck of the ampule and break off the top away from you and other people for precaution. Now I'm gonna place the antiseptic wipe, pack it over the top, and dispose the top. In withdrawing medication, what we have to do is to hold the ampule. So I'm currently holding it, and I'm gonna slightly push it on its side and aspirate medication. If giving injection, replace aspirating needle with regular needle. So we're gonna, and after that, I'm gonna tighten the cap at the hub of the needle and place over the medication tray. So now it is ready for injection. So in performing subcutaneous injection, what we have to do first is to perform hand hygiene or hand washing. And after that, we're gonna need to provide privacy for the patient. So we have already closed the door to provide privacy. After that, I'm gonna introduce myself to the patient. Ma'am, my name is Grace Armando. I am your student nurse for today. And also, we need to verify the client's information. So let me see your wristband, please. Can you please state your name?
Jason Vergara.
Jason Vergara. Your age?
19.
19. And your birthday?
March 25, 2004.
Okay. After that, we're gonna assist the client to a position where the arm, leg, and abdomen can rest. So, like this. So, now I'm gonna start opening this side. So, can I open this one? Okay. After that, I'm gonna clean the side. Start at the center of size and clean in widening circle to about 5 centimeters. Now I'm gonna apply clean gloves. And after wearing the gloves, we're gonna need to prepare the syringe for the injection. I'm gonna remove the needle cap while waiting for the antiseptic to dry. Now I'm gonna grab the syringe in dominant hand with palm facing to the side and the for 45-degree angle. And we're gonna prepare to inject. Using non-dominant hand, pinch or spread the skin at the side and insert the needle. Using the dominant hand and steady push. I'm gonna depress the plunger with slow and even pressure. And now I'm gonna remove the needle smoothly. If bleeding occurs, I'm gonna apply pressure to the site with dry sterile gloves. Okay. I'm gonna dispose the supply appropriately, and after that we're gonna do an aftercare. And now I'm gonna remove the gloves and dispose the item in an appropriate waste. And after we have done with the injection, I'm gonna perform hand hygiene and assess the effectiveness of the medication. So we're gonna observe it, and also we're gonna need to document all the relevant information, including the patient's reaction. So the first thing we need to do in intramuscular injection is to perform hand hygiene. Also, I'm gonna introduce myself to the client. Good day, ma'am. My name is Grace Ramondo, and I am your student nurse for today. And also verify the client's information. Can I please see your wristband, please? Can you please state your name,
Jason Vergara,
your age,
20,
and your birthday?
September 20, 2000.
Okay. Now I'm gonna assist the client to a supine, lateral, prone, or sitting position. I'm gonna assist you now. And now I'm gonna explain the purpose of the medication. So the purpose of this medication is to lessen the pain of your body. So is that okay for you? Okay. Now I'm gonna locate and clean site of the injection. Select a site free from skin lesion, tenderness, swelling, hardness, or localized inflammation. After locating the exact site, I'm gonna apply clean gloves. After wearing the gloves, I'm gonna clean the site with swab. For about 5 centimeters in a circular motion. Transfer and hold the swab between the third and fourth finger. Now I'm gonna prepare the syringe for injection. I'm gonna remove the needle cap while waiting for the swab to dry. Now we're gonna inject the medication using Z-track technique. So in Z-track technique, the first thing we need to do is use the vulnar side of the non-dominant hand to pull the skin appropriately. So like this. That, and then I'm gonna hold the syringe between the thumb and forefingers. I'm gonna pierce the skin quickly like we are using dart, 90 degrees and about 5 seconds. Now I'm gonna the plunger. Then after that, hold the bar of the syringe steady with non-dominant hand and aspirate, pulling back the plunger. So if blood appears, withdraw the needle. So there's no blood that appears. So now I'm gonna clean or apply the swab. After that, I'm gonna discard the uncapped needle into the proper receptacle. Removes and discard gloves and perform hand washing or hand hygiene, hand rub. Now I'm gonna document all relevant information, including the time of administration, the drug name, the dose, the route of administration, and the reaction. And after documenting, we're gonna assess the effectiveness of the medication, so we have to observe it in a while.